Hi there, my name's Erica Gilbert and I'm an Education Coordinator with the Western New South Wales Primary Health Network. Thank you for accessing this pre-recorded Aboriginal health and wellbeing education resource, which is regarding patient information about long COVID. I'd like to start this recording by acknowledging the Wiradjuri Nation as I'm sitting in Dubbo today, and also the Barkindji Nation as I grew up in Wilcannia on Barkindji country. I'd also like to acknowledge that we work on the traditional lands of many Aboriginal clans and nations and pay respect to elders past, present, future and emerging, and acknowledge their continuing connection to land, water, culture and community. We are committed to working in the spirit of partnership and collaboration with our region's Aboriginal communities and peoples to improve health, emotional and social wellbeing. I warmly welcome Aboriginal and Torres Strait Islander Australians who are viewing this recording. I'm now very pleased to introduce our presenter, Marsha Files. Marsha is an Aboriginal woman from Barkindji country. Marsha has worked in the health sector for over 18 years and currently works in collaborative commissioning in type 2 diabetes for Western and Far Western New South Wales. Unfortunately for us, Marsha is about to embark on a sea change and she will be very dearly missed. Marsha will actually be on the road to the South Coast by the time we've edited this recording. So we wish her and her family safe travels and all the best in the future. So I'll hand over to you now, Marsha. Thank you.
Thank you, Erica, for that very warm welcome. So nai nunganya wali numai mangai Marsha Files napa Barkindji Wimutunungu Buli Wangapa. So hello, how are you all? My name is Marsha Files and I am an Aboriginal woman from Barkindji country and I am Eaglehawk Meat or Moiti. Today we're going to be discussing some information around long COVID as our communities have been affected by the COVID outbreaks, as many other areas of Australia and internationally. We'd like to provide further advice and information on this. So what is long COVID? So long COVID is the ongoing or new symptoms of COVID-19 and it can change and come and go over different periods of time. So it could start initially from the end of COVID when someone has started to recover. And it can be described in groups of symptoms or for how long the symptoms may continue. So they are described as firstly acute COVID-19. So if these symptoms may last for up to 4 weeks and it is called acute COVID-19. Post-COVID syndrome, if you have ongoing symptoms that continue for longer than 12 weeks and cannot be explained by another underlying condition, and this is called post-COVID syndrome. Some of the symptoms may be that you're feeling puffed out or heavy in the chest. With COVID-19, some people have a sore throat or a severe cough, and some feel breathless or have tightness or pain in the chest, and some feel their hearts beat so fast that it feels like it's beating out of their chest. You may be feeling tired. With long COVID, people can feel really tired and unable to do their normal activities. You might have difficulties doing your chores at home or cooking or cleaning or washing, looking after yourself or even the children or family members that you have. There's other times that people can feel quite feverish and may have issues with pain also. Brain fog, or you can't think. So with long COVID, sometimes people feel a little foggy in the head and can't think really straight. You can forget things and can't remember what people may have said to you. Older people can get confused. This is another effect of the symptoms of long COVID. You may be feeling woozy. So some people have headaches, some people feel quite dizzy, and some people can't even get out of bed. Some people feel pins and needles in their body, and older people can have falls and potentially hurt themselves. So keep an eye on your families when they may be experiencing long COVID also. You may have stomach aches or pains. So long COVID can mess with people's stomachs and give bad stomach aches or pains. People say that they have diarrhea or feeling off their food and may even potentially lose weight quite rapidly. Sometimes people can't smell or taste things, so everything tastes really bland, and you can't smell the things that you enjoy smelling, like food or other smells around the house. Some people can't even smell for danger. For example, things like smoke in the house or a gas leak. Feeling sore. With long COVID, people can have ongoing aches and pains in their muscles and joints, and you can find it hard to lift or carry things or even to pick up the kids. You may find it difficult to climb stairs or even just to get around for your daily routine. Some people can't sleep or they'll sleep too much. Long COVID tends to cause a lot of issues around people's sleeping patterns, so it's really paramount that people go and see a doctor when they're feeling these symptoms. Some people feel really down, so you could have a really low mood or feel like you're in depression. You can feel very anxious or a bit worried about going out in public, and you can get worried about your future and the kids' future also. Try not to worry. All of the symptoms will generally improve within 4 weeks. Some can take longer, potentially up to 12 weeks, but very few people have symptoms beyond the 12 weeks. If you or your family member is worried about long COVID symptoms, please contact your GP, your local AMS, or your family doctor to make an appointment. I'd like to say thank you to all of the participants in this presentation: Sandra Wicks, Kathy Robbins, Kayla Ramirez, Damon Bell, and Madison Spencer. Thank you for your time, and please get your family and community safe and well, and get checked by your doctors when you feel the effects of long COVID creeping in. All right.
Thank you, Marsha, so much. That was a great overview of COVID and the symptoms and um, what their journey might look like to full recovery. So thank you so much. And once again, we wish you well. Thank you. Take care, everyone.
Thank you, everyone, and good luck to everyone's families and communities.
Absolutely. Bye. Thank you.
Thanks, Marsha.